Good evening. Today's update since our last report, Florida has seen 24 new positive cases, bringing the state's total to 216. 196 of those are Florida residents, 20 non-Florida residents, and there are 1,042 test results outstanding. We're going to announce a number of things related to education. For the remaining, from this school year on, all remaining testing for school readiness, voluntary pre-K, and K through 12 will be canceled for the school year. Requirements for graduation and promotion and final course grades will be evaluated as those assessments did not exist. Parents may, at their discretion, choose to keep their child in the same grade for the 2021 school year. K through 12 grades will not be calculated for 2019-2020, and schools in turnaround may continue their current status next year to avoid disruption to school leadership and operations. Commissioner Corcoran may reduce required K through 12 instructional hours as necessary to accommodate for closures, as we've seen. All school readiness, voluntary pre-K, public K through 12, private scholarship programs, career and technical centers, and state college programs will be fully funded as though there was no disruption. For the next 120 days, the deadline will be tolled for any teachers who have to take tests, and in addition, all the fees for any test takers will be waived. The department and K through 12 school districts are instructed to redirect unspent 2019-2020 funds from various allocations to help low-income students purchase digital devices and establish internet services so that they can engage in remote instruction. In order to facilitate the remote connection between teachers and students, K through 12 school districts are further permitted to redirect unspent Title II funds to help low-income students purchase digital devices and establish internet service. K through 12 school districts are permitted to redirect unspent 2019-2020 funds from the safe schools and mental health allocations to virtual and telephonic mental health counseling services for students that need emotional support due to the outbreak of COVID-19. To support students with identified IEP-related services who may have a disruption in services, school districts are given flexibility for the remainder of the school year to provide alternative services or delay services until later in the summer months in coordination with the students' parents and IEP team. Today I spoke with Senator Rubio about some of the economic relief that they're working on in Washington, and I think he and I agree that there's going to be a need for immediate relief for a lot of people that are going to be dislocated by the economic effects of the COVID-19 virus. So I know that there was a bill passing the House. He indicated to me the Senate is going to do a lot more, whether that's adding that on or doing a third bill. But we understand throughout our state that we're going to have people who probably already, but certainly in the near future, that will be impacted by mitigation efforts that's undergoing, not just in Florida, but nationwide. The numbers on Monday for Florida's unemployment was 2.8%. We had a great year leading up to that point. And I think a lot of things were going great with the economy. This is an external factor, that is going to cause problems. And so we at the Florida Department of Economic Opportunity, they stand ready, Director Lawson, to help those Floridians who are going to need reemployment assistance. If you have been negatively impacted as a result of the mitigation efforts in Florida to stop the spread of COVID-19, you may be eligible for reemployment assistance. And so if you are ordered to self-isolate by a medical professional, government agency, if you're laid off or sent home without pay for an extended period by your employer because of COVID-19 concerns, or if you're caring for an immediate family member who's diagnosed COVID-19. So we encourage any Floridian whose employment has been negatively impacted as a result of COVID-19 to visit floridajobs.org and click on Reemployment Assistance Service Center to learn more about the program and to watch a short video on how to apply. I also want to just commend, we have a number of businesses throughout the state who have stepped up to help some of the folks who need assistance. Florida Power and Light suspended service cutoffs over overdue bills, given the epidemic. And then their parent company, NextEra Energy, committed $1.5 million in COVID-19 emergency assistance for the most vulnerable individuals and communities throughout the country. We also have suspension of disconnections from Duke and TECO, Tampa Electric, which we appreciate. Uber is waiving delivery fees on all orders from independent restaurants across the U.S. and Canada, and they're delivering free meals to healthcare workers and first responders amidst the crisis. So we appreciate everybody who's stepping up. I know there's a lot more who are doing it, and we want to continue to see that. I want to make clear, because it's been said a number of times recently about who qualifies for COVID-19 testing. It's true. When this first started, the CDC was looking for travel to China, looking connections with that. But here's where we're at now. I mean, if you are elderly, 65 or plus, and you have symptoms of COVID-19, regardless of where you've traveled, who you've interacted with, you are eligible to be tested. If you're somebody, regardless of age, that has an underlying medical condition and you have symptoms of COVID-19, you are absolutely eligible to be tested. If you're somebody, regardless of any travel or interactions, that has been hospitalized with pneumonia or an unknown cause, you are eligible to be tested for COVID-19. Now, we've done a lot to expand the testing capability. We're going to be doing more. We're going to hopefully work on the Broward thing very soon, have an announcement there. We're also working some other places up in the state that need some assistance. Jared has a lot of the materials. We did send 100 test kits through both the health departments and hospitals and private labs. That's enough to do about 250,000 tests. The way this is, you need the swabs and everything else, so we have more of those that are coming, I think, pretty soon tonight. So we're going to have capacity, but certainly if you're in one of those groups, it's not going to be a question about any type of limited guidance. You are absolutely eligible. We want you to have access to that, and we want you to be able to do it free of charge. So it's very important that that message gets out. We will be hopefully making an announcement about the opening of the Broward drive-through testing that we're working on in conjunction with Memorial Health and the Florida National Guard, and I think that could be a positive development. So with that, I'm happy to take some questions.
Governor, there are a couple of deaths being reported through social media and through officials, but your office has not, or the Department of Health has not confirmed possibly 2 additional deaths at a assisted living facility?
So we did report the 1 death today. There is another individual, I believe, in the same assisted living facility who also died but has not yet tested positive. If they do test positive, then obviously that will be reported. But this was an individual that had been hospitalized with some serious issues anyways. So we'll await that and then be able to put it out. And then I did not get any new death figures when I came out, but if there are any since earlier, that will be reflected in the update. Yes, ma'am.
Also on schools, just to clarify, so you talked about waiving testing and things of that nature. Does that mean that students in K through 12 schools will be online for the rest of the spring semester?
I don't know it means that for sure, but I think we're viewing it as, let's say that this thing is arrested and things get better into April, maybe kids are back. I think it's our position, Richard and myself, that we're not going to then ramp up to do the testing. So that'll be true whether it's virtual or whether they're back in school.
Just to clarify, does that mean that there might be more announcements on more weeks of virtual learning after the 2 weeks that have already?
So we're going to make a decision on that this week. I don't know, Richard, why don't you tell about the few counties what they're doing?
So all we've said basically to the K-12 schools is we're extending not going onto the campus till April 15th. Because we did that, as the governor said, you can't have kids come back and then you need about 2 weeks and then you'd have to, so we'd be into May for testing. It's not going to work. But what we're saying to the schools is they still have to give those instructional hours, and they're going to do a fantastic job. We've had 4 schools who've already been on spring break. Of the other 63 are on spring break this week or next week. So they're going to come back on Monday. Most of the K-5 kids, they're going to do all kinds of innovative. They're using the bus drivers to have drop-off points, just like with the food, for instructions for, bi-weekly. On the 6 through 12, almost all of them have devices, or they have money now that they can spend for devices for low-income kids and internet access. So all the 6-12 will be virtual. No, and then as the other schools come online, because they have the spring break and the 1 week off that ends in March, as those come on through April 15th, all schools will be doing similarly as being done by Duval, Sumter, Collier, and Union are already doing it and are up and ready to run on Monday.
You referenced universities taking the rest of the semester off. What about the 28 community colleges and community colleges?
Just so we clarify, they're not technically off. They are going to do remote learning, but we want them to be doing that where the students are doing that from their homes of residence, with their parents or wherever they, but we don't want to have thousands of undergraduate students hitting bars, or I guess they can't do the bars now, but just congregating in a fraternity house or something and doing that, because we're trying to create some social distance, so we feel that that's the case. Richard, you want to address how they handle the colleges?
The colleges are remaining closed just as the universities, and they will continue the semester remotely as the universities are, and get the full semester in and for learning.
Will you expect staff to show up on campus, or
No, we leave that to the discretion of the presidents. They run the university, but generally speaking, even the professors are doing it by remote access.
Governor, about the federal stimulus, and talking with Senator Rubio, perhaps also the White House, any asks that you had specifically to Florida, any things that you would want in there to help out?
What I want is immediate relief for people dislocated. There's all these great ideas people talk about of, like, initially the House wanted to do a program through the Social Security Administration for sick leave. And I'm just thinking to myself, have you ever dealt with the federal government? They get the sick leave in December, and that is not what's going to make the difference. You're going to have people who are living paycheck to paycheck, who were involved with industries that were doing very well, and they were gainfully employed, and they're all of a sudden not going to have a job. And we hope that that's a short-term thing. But I can tell you, if you can get money into the hands of folks, and I do think some of these small businesses, so Senator Rubio and I talked about, we did $50 million for the bridge loan here. They're looking to do something even more significant, which I think will be very, very important. I mean, this is so much different than some of the other kind of crises we've seen. In 2008, you had a lot of people that made a lot of bad decisions, and then they ended up getting money on the back end, even though they made the bad decisions. Here, you have people who were doing a good job, and a lot of these folks were doing well, and you have an external event that does something. So if you're a small business, what you don't want is you to go under and have no chance to make it through this when you didn't do anything wrong. And in fact, a lot of these folks are doing our unemployment rate was 2.8% here. A lot of people were doing a lot of great things. So relief, as much relief as we can get to get them past this period. I do believe that there's going to be pent-up demand. I mean, I think that people are already getting a little tired with with all the changes we've seen in society, and hopefully this doesn't go on for months and months. But I can just tell you, when we get on the back side of this, I think people are really going to want to get back to work. So I think immediate relief for the folks dislocated, and then help for those small businesses who have liquidity, who may have liquidity problems and have a real serious cash crunch. That's what we tried to do with the corporate deferral for the taxes in state, and that's what we're trying to do with our bridge loan here. The federal government, obviously, they can bring some more resources to bear, so I'd encourage them to do it.
Is there, quick follow-up, we all know that it's not the easiest to appropriate the money. I mean, Congress can say that here's the money, but actually appropriating it's another issue, and grants can take months to apply for.
Well, that's why on this, they asked Mnuchin, hey, if you want to get cash in the hands, does that mean a millionaire would get it? And he's like, of course not. And I don't want a millionaire to get it. But the thing is, the minute you try to do all this, it makes it more complicated. So I'd say as simple as possible, get it to the people that need it. If by doing that, some people that don't need it get something, fine. I'll encourage them to donate it to charity. But it has got to be done quickly and simply Otherwise, it's just not going to have the intended effect. Yes, sir.
Can you walk us? When did you first learn about this death at the Assisted Living Center in Broward? And can you walk us through how the state is responding to this right now?
So I learned about it this morning because it happened overnight. So, well, I'll let the Surgeon General. I mean, they sent a team immediately. And yep.
Yeah, thank you. We learned about it late last evening, and we immediately sent a strike force team out there from the Department of Health, which had the director of the county health department there, epidemiologists, infection control experts, nursing, representation from ACA, and representation from the facility. Then later in the evening, we actually had a call with the Center for Disease Control where they took information, and then had further follow-up this morning with CDC.
I had a follow-up question on that. I know that local officials in Broward County were reporting 3 deaths, not the 2. Can you expand on that? Is that related? I know it's 2 at the one facility, but what about the 3rd?
Yeah, we have 1 confirmed individual who passed from COVID-19, and all other individuals who have symptoms for that or passed away are being evaluated.
Governor, on the people paycheck to paycheck, it's my understanding that Florida's max unemployment benefit per week is $275. It also has it's among the lowest.
It's a little higher. What is it? It's 275 still? Okay. Yep.
And it has one of the lowest amount of max state paid level. I know the federal can get in. Is that something that should be looked at in light of the crisis we're about to have?
I think we're going to look at everything. I mean, I think that we obviously have a role at the state to play, but I think that the federal government's got the really the might to be able to bring a real quick relief to bear. And I think most of the people up there now, I think, are thinking in that way. And I think you heard the president today. He had talked about the payroll tax cut. He said, look, I like that, but I also understand, this is something that'll be over several months. Get something out quickly is something that makes a lot of sense. So I do think you're starting to see a convergence on that, and hopefully that'll be helpful. And then we have to look at what we're able to do to help as well.
Sorry about that. I would like a follow-up to Sam's question. I think she said there may be 3 deaths at 2 different facilities, and I wasn't sure that was clearly explained.
Yeah, so we're talking about 1 facility where 1 individual who passed away was known to have a COVID-19, and we don't have any other confirmed COVID-19 cases, but we're looking at it for the individuals at that facility.
So
Thank you.
Looking at 2 facilities.
No, one facility, looking at other individuals who may have been at that facility that passed away to see if they have COVID.
And how
One
many people are in that facility?
Oh, yeah. Yeah, there are 218 individuals in that facility.
And then I just have a follow-up. The governor said earlier that certain populations are, I think this may be for the governor or ACA secretary, but you said earlier that certain populations can get the shot. But I thought I heard Secretary Mayhew say yesterday that the shot is not being given to some frail elderly.
Test?
I'm sorry, the test.
Yeah. So no, I think what Secretary, she has said, we need to make this clear because I've been saying to people and saying it, but there's still, I think, some that are relying on kind of outdated guidance, and so that's one of the reasons why I wanted to come and say very clearly, all those individuals I enumerated qualify, and so while we have limited resources and a guy like me who's younger and doesn't have any symptoms, I just shouldn't walk up and get a test. It's not a good use of resources. When you have some of these folks with symptoms, you don't need to go in the travel history. You don't need to go in this or anything like that. They should be given access to tests. And so we just want to make that clear to folks. Obviously, we've worked hard to bring more testing. Jared's brought a lot of materials. Let me tell you, that stuff is being hotly sought after across the country right now, and so he did a good job for Florida to have ordered that very early, and that's been distributed, a lot of it, and then some of these other things, people run out of swabs, all that. We've got more of that coming in, and so that'll be, the materials will be there. The labs, what happens with these CLIA certified labs? So we had 3 state labs that would do the testing. So remember, originally, anybody that was swabbed, you had to send it all the way to Atlanta and the CDC. So that was taking 5 days before someone could get a result. So doing the state labs allows it to be usually about 48 hours. But what happens with the state labs is you can run a test in probably 4 or 5 hours if you just put it right in. The problem is if you do that, then you can't test anything else. So if I just had one sample, run it through, I could do it in 4 or 5. But then I wouldn't be able to use that machine. So what they do is they fill up the capacity, then they run it through. So it takes longer than just 4 or 5 hours, but it's more efficient to do it that way than if you did it one at a time. So we had all 3 of those labs that are doing that, and so they have the capacity, to do several hundred a day. The other CLIA labs, Jared has gotten test kits to them. Some of the other stuff that they need, the positive, negative, is going to be delivered too. Some of them have it, not all. But they're in the process of kind of making sure that their labs are able to do this. So there's a little process that goes. So I think, Scott, what do you think? Like next week, a lot of those other CLIA labs will be able to do it. So that just expands capacity. But I think it's like 3 months ago, I didn't know anything about but this is not just like you go and do. It's a test that involves a lot of different things, and it's novel. It requires a lot of manpower, a lot of lab work. So I think by having more options to do this, we're going to hopefully be able to do this. And then LabCorp and Quest, we have a contract with them, so we can send this stuff overnight. They test it, and they're usually turning it around within 48 hours, and they'll actually notify the person directly with their results. And so we're a lot different than where we were 2 weeks ago with the testing, and I think hopefully next week and beyond I'll be able to say, we're doing even more. One more.
So a question about the drive-through testing lab in Broward County, and in light of your recent comments about the groups that are enumerated that can be tested. What's the state's response going to be if people who are not in those categories show up there to be tested?
So what we're going to do, and we will firmly announce this very soon, but I can tell you the priority one group is going to be the healthcare workers, because they need to know whether if they've been exposed, if they're positive, if they show symptoms, do they have COVID-19 or not? And so we want to make sure that they have the ability to do it, and then we also want to make sure that those folks who are 65 and plus and are exhibiting symptoms, that they have an easy way to go in and get tested. So those two for sure are going to be priority. And then it's just a matter of working with the hospital, seeing the kind of manpower. I mean, you've seen this be tried across the country, and a lot of times it hasn't worked. What we don't want is to have people waiting in line for 4 hours in their cars thinking that they're going to do. So I think what it'll be is there'll be clear criteria, and then you will hopefully be given a window of when to come so that you're not waiting in your car all day. And then as that gets up and running, and that model is something that people are comfortable with, then we can look at going beyond that. But there's other opportunities to be tested. But that is what we're going to do to try to get it going in a good way. The National Guard's put a lot of folks there. I mean, I think they've got. I mean, they're knocking down trees. Are they knocking down trees and stuff? So they're knocking down trees to make sure people have room and the cars and everything. So they've worked really hard. And then so we want to do that. And then we also, I had mentioned, we've requested 3 sites from the federal. That hopefully can happen soon, but I can tell you I don't think it's going to be where the feds come and they say, let's start testing. I think they're going to provide us materials, and then we're going to have to partner, have a healthcare provider be involved. We may have to have some Guard personnel. Jared has healthcare professionals on contract that we can surge in. But my sense is they're just going to be dropping this stuff at various locations. So we're going to have to look at that. And then I also talked with Mary about if they do choose Miami, Orlando, Jacksonville, and then we have the Broward, then we'd look on the West Coast, maybe look at Tampa, one of those places, to see if we could partner there. So, this thing is something that is a work in progress, but I think they've made a lot of progress on this thing, and we just want to go and get as many people results as possible. I mean, part of the problem with this whole response in terms of the mitigation is you're doing mitigate, and I'm not criticizing any of the mitigation that the president's recommended, but you're doing it not really based on a lot of data. I mean, that's just the reality that we find ourselves in. With influenza, they have a surveillance program, so they'll test hundreds of thousands of people for influenza, and they'll know, how many are positive. Then they can build a model about that. Here, you're relying on half-baked figures from China. maybe the Italy numbers are a little bit better, but the extent to which this is being spread in our society by people who have minimal symptoms and who may not be in these age groups is kind of a question that nobody really knows the actual answer to, but that would obviously help us inform it. And so the more we can do the testing, I think most people are going to come back negative, but it gives us a better baseline, I think, to be able to make some of the decisions, because we're in a situation here, there's going to eventually be mitigation fatigue with the public, and you don't want to be doing mitigation in areas where it may not be required. And if you can isolate better because you have the data to do it, then you're in a position where I think you'll have more tools to be able to bring to it. So there's just a lot that's going to go into it, but I'm happy that we're going to finally be able to launch something this week, and we just want to keep working with folks, because I know a lot of people are really concerned. I mean, just roll back 3 weeks ago. I mean, we knew this Wuhan had broken out. You had seen some stuff, but just think how it's escalated and how concerned a lot of people are. And so we want to be able to help folks. And if there's folks that have these symptoms, particularly in those groups, we want to get them tested. So we'll have an update tomorrow. But thank you guys for coming out.
Thank you.
Good night captions, good night satellite from Tallahassee.
Hang on 1 second. I'm going to bring the Commissioner of Education back so he can answer some questions.
Good night. Excuse, is this going up on satellite?